Welcome back, everyone. So glad you're with us today. KUTV and Intermountain Healthcare have been answering any and all questions you might have about diabetes today. And joining me now is Betty Wade. She's a registered dietitian with Heber Valley Medical Center. And we're talking about today, Betty, healthy eating, because that goes hand in hand with keeping diabetes at bay, does it not?
It does.
So tell me about how people can change their diet and be more healthful so that they don't have to face diabetes in their future.
It actually is pretty simple. It's the basic things that we've known our whole life. We need to eat balanced foods. I tell most of my patients to remember 3 things. You want protein with the meal, you want a whole grain, and you want fruits and vegetables.
What about yo-yo dieting? It seems like people will get a little panicked and maybe think they're on the verge of getting diabetes, and they'll go on some crash diet, lose a lot of weight, but can you really maintain that?
Most people cannot. Some people can do that and then go on a healthy diet, but however you lose weight is usually how you have to continue eating, which is why we want people to be healthy and balanced. Then it comes off more slowly, but then you're changing your lifestyle as you go instead of going back to the old habits as soon as you get off the yo-yo diet.
And we talk so often about how obesity is a big problem in America right now. Are you seeing a huge spike in the number of cases of diabetes?
Yeah, sometimes, and I work in a rural area, sometimes I think everybody I know has diabetes. Yeah, there's a huge increase in diabetes.
Really quick, because we're almost out of time. If people are at home, are there symptoms that they can look out for? Maybe they need to call and ask if they're at risk.
Probably the one they're going to notice the most is fatigue, especially after eating meals. The blood sugars get really high, increased thirst, and increased urination, unexplained weight loss.
Betty, thank you so much for the great advice. Again, if you have any questions, call the number on your screen. People are waiting here to answer your questions.